In this video, we are going to discuss the next prominent cause for antimicrobial resistance, which is inadequate diagnostics. Medical infrastructure in a highly populated country like us is a big disadvantage. We lack the quality medical infrastructure which can make diagnosis, treatment, and even prevention for that matter much faster and rapid process. Because there are no rapid diagnostic techniques available when it comes to infections, normally physicians end up prescribing a broad spectrum antimicrobial agent, which we have discussed of in the past as well. That unless you really know that what exactly is the causative agent of the infection, you are kept on a broad spectrum antibiotic, which may kill, unnecessary, microorganisms as well, which could have been really beneficial for your system. And there is an unnecessary exposure also of antibiotic, which may not be required at that point of time. So if we have a mechanism by which diagnostics can be very specific, very rapid, we can have specific antimicrobial agent prescribed, and that could reduce the chances of antimicrobial resistance to a great extent. Hospitals are a hub of developing antimicrobial resistance because there is a heavy use of antibiotics in these environments. Mostly for treatment purposes, for therapeutic purposes, because the patient may be in a severe condition, the condition may be worsening, so the doctor tries out different formulations, different combination of medication to save the patient. And because there is such a heavy use of medication in such an environment, the chances of antimicrobial resistance also developing there is very high. So of course, this is not something that we can really control, because at that point of time saving life is very important. But the other things that happens, over-the-counter medication, misuse of antibiotics, undue use of antibiotics, this is something that we can control, right? So we have to see to it that we bring control over those aspects which are under our reign. Even doctors try their level best, to be honest, to prescribe only those antimicrobial agents which are really essential at that point of time. Okay, they are also very much aware of this problem. They know how big issue antimicrobial resistance is, and they are juggling and struggling with this kind of a challenge every single day out there. So they also try their level best not to prescribe something when it is not needed. Okay, then comes agricultural use. We have to understand that the way we suffer from infections, even plants suffer from infections, bacterial infections, fungal infections, viral infections. So these days, even in agricultural farms, antibiotics are used to prevent any kind of infection to the crops, because there is a severe loss in crop yield and the economic loss becomes too much to handle, because of which they end up using antibiotics, using antimicrobial agents in the farm as well. And ultimately, when rains come, when you water the field, all that water seeches, goes to the groundwater, or it goes and joins some streams, lakes, rivers, where it comes with more contact with microorganisms, and this is how more resistance will spread, because there is an undue exposure of these antibiotics. Moreover, poultry farms is one of the biggest area where antibiotics and antimicrobial agents are used to a great extent to stop infections that may happen to the chickens, because if chickens get infected, then the yield of that entire poultry farm gets affected. So they start giving antibiotics, antifungal agents, antiviral agents to the chickens in the water and food that is provided to the chickens, so that they don't suffer from infections and there is no loss of yield. This again leads to an undue exposure of microorganisms to antimicrobial agents. Another area is dairy farms. Even in dairy farms, antibiotics are used so that infection doesn't happen to the dairy animals, because the cattle, once they are infected, their milk cannot be used, it cannot be supplied for consumption, so there is a huge loss. So several dairy farmers also end up using antimicrobial agents even when it is not needed, because they do this as a precaution so that infection doesn't take place. And if you make use of these antimicrobial agents even when it is not needed, see, if there was an infection and they made use of it, it would have been different. But you using it unnecessarily just because you want to prevent it is going to increase the prevalence of antimicrobial resistance. So these are all, major causes. There are some more, which are significant ones, which we will discuss in the next video. So stay tuned.